In this video, we are going to be looking at the inguinal canal with specific focus on the formation of the spermatic cord. In order to do that, first we need to recap some of the structures of the anterior abdominal wall of particular interest. So, components of the abdominal wall from deep to superficial. The deepest layer of the abdominal wall is the peritoneum. If we are being specific, we say the parietal peritoneum. That isn't visible on my drawing because I'm not that skilled, so let's move on to another element I couldn't draw. The transversalis fascia. This lies between the parietal peritoneum and the transversus abdominis, as indicated here with its horizontal fibres. The next superficial muscle is our internal obliques, followed by our external obliques, and finally, scarpus fascia and our skin. Why do we have an inguinal canal? Well, for biological males, the inguinal canal is the channel formed on the abdominal wall in the groin region that allows testes to descend during development. The testes develop retroperitoneal, near the kidneys. That is, they develop on the back wall of the abdomen between the parietal peritoneum and are pulled inferiorly by my favourite word, the gubernaculum, from about 16 to 17 weeks post-conception. By the 7th month, they've made their way to the deep inguinal ring, and over the following few weeks they should have completely descended and sat comfortably within the scrotum, held in place by the remnant of the gubernaculum, the scrotal ligament. Well, where is the deep inguinal ring? If we look at my sketch of the bony pelvis, we have the anterior superior iliac spine and we have the pubic crest. The inguinal ligament attaches to these at 2 points and forms the floor of the inguinal canal. The deep inguinal ring, the entrance to the inguinal canal, sits about 2 to 3 centimetres further along the inguinal canal as indicated here. On the living person, we are looking at this location, or mirrored on the left-hand side of their body. Okay, moving on to look at the formation and the contents of the spermatic cord. Let's draw a model of the layers of the abdominal wall so we can see what happens. The most superficial layer is the skin and the scarpa fascia. I'll draw this in black. After this, the next layer I'll colour in orange. And the area we are concerned with is the aponeurosis of the external obliques. Then on my sketch we can see this purple layer. This is our internal oblique aponeurosis. The blue layer follows, and this is the transversus abdominis muscle. Then, as we have discussed, we have the transversalis fascia, and finally the peritoneum. Now I'll turn this model around as it will make it easier, but the layers stay the same. The skin and the scarpa fascia remain the most superficial, and the peritoneum the deepest layer. Let's add in a testes so we can see where we are travelling. On the left-hand side, we have a testes and a vas deferens and a collection of vessels and nerves that we can pretend for now is fully developed and sat within the scrotum. Whereas over here, on the right-hand side, we can see the testes just before its descent through the deep inguinal ring. Now the testes is going to be travelling in this direction. Remember, because the inguinal canal is oblique. As it makes its descent through the deep inguinal ring into the canal, it's going to take some structures with it. The first thing it's going to take is the peritoneum, which seems a little strange because the testes develops between the peritoneum and the posterior abdominal wall. But the peritoneum attaches to the testes during its descent. Once in the canal, this peritoneum is known as the tunica vaginalis because it has invaginated. so it doesn't surround the testes but instead is just pulled through with it. As the testes continues to be pulled inferiorly by its gubernaculum, it pushes through the remaining layers, pushing the transversalis fascia through the deep inguinal ring. Now, in most videos of the inguinal canal, the transversalis fascia is said to have a hole in it. This is not strictly true. It remains continuous, but it has a change of name once the testes has pushed the fascia into the inguinal canal. Once in the inguinal canal, the transversalis fascia is now known as the internal spermatic fascia. Now, we also reach this blue structure that we now know to be called the transversus abdominis. What we know about the transversus abdominis is that the majority of the fibres go to form the roof of the inguinal canal. So the testes doesn't travel through it, instead travels beneath it. And that results in our model looking like this. However, some of the transversus abdominis fibres do go on to join the internal oblique fibres, which is represented by this little symbol here. So the TA fibres, the transversus abdominis fibres, that enter the inguinal canal are blended with the internal oblique fibres, but the majority have gone on to form the roof of the canal instead of getting involved with the testes. Okay, so we've already mentioned the internal oblique, and this muscle also gives off fibres to the roof of the canal, but the testes does take internal oblique with it on its descent. It's met with some of the transversus abdominis fibres once in the canal, and together these internal oblique fibres and transversus abdominis fibres within the canal blend and are known as the cremaster muscle. This muscle acts along with another muscle which we will meet shortly and is used to control the temperature of the testes. When it contracts, it draws the testes towards the inguinal canal, closer to the body when the environment is cold. This is known as the cremasteric reflex. The external oblique aponeurosis is also drawn inferior with the testes, as shown here. Once in the canal and part of the spermatic cord, it changes its name to the external spermatic fascia. Our final layer in black is slightly more complicated, as this is the most superficial layer, made up of scarpa fascia and the skin. This layer travels most of the way around each testes, as shown here. But it meets with the other testes' skin and fascia along the midline, enclosing both testes together in the scrotal sac. The line at which they meet is called the scrotal raphe. We have mentioned this layer represents two components. We have the skin, which naturally is the most external component, but we also have the scarpa fascia. This embeds within the skin of the scrotal sac and forms muscle fibres called the dartos muscle. The dartos muscle works with the cremaster muscle to elevate the testes when the environment is colder than optimal for sperm production. And the action of this muscle, along with the location, is responsible for the wrinkling of the skin of the scrotum. Let's have a brief look at the contents of the spermatic cord. Let's take a cross section from here. Imagine that we are looking down the spermatic cord. We have the tunica vaginalis, which does not encase the testes. We have the vas deferens, the sperm tube, sometimes called the ductus deferens, along with a collection of vessels, such as the testicular artery, the venous plexus, or as it's known, the pampiniform plexus, which acts to drain the blood supply to the testes, but also acts to cool the arterial blood supply down before reaching the testes. We have the genital branch of the genitofemoral nerve, which innervates the cremaster muscle, and we have a collection of lymphatic vesicles. We then have the internal spermatic fascia. The cremaster muscle the external spermatic fascia, and finally, although difficult to represent in this cross-section, the dartos muscle and the external skin. So, to summarise, the anterior walls of the abdomen over the groin area play a role in the spermatic cord and inguinal canal formation. The peritoneum is dragged along with the testes despite not encasing it. The transversus abdominis gives most of its fibres for the roof of the inguinal canal, so we don't typically consider it having a huge role in the spermatic cord. The contents of the spermatic cord are continuous with the anterior abdominal wall, just with a more complicated name. And there are two muscles which act to elevate the testes, the cremaster muscle and the dartos. Finally, the spermatic cord also contains a plethora of vessels which go to supply the testes.